Intractable diseases mean the disease cannot be cured by current medicine. Though we have achieved a lot in medicine, there are still lots of problems that remain uncurable. Chronic atrophic gastritis. What is chronic atrophic gastritis? The main pathogenesis is that the gastric tissue is replaced by intestinal tissue. Currently, there is no effective method to relieve or cure it. Because there is no effective treatment in science, these conditions are called intractable diseases. However, our treatment can handle these diseases successfully. It will only take 1 year to regeneratively restore the intestinal tissue in the stomach into normal gastric tissue. That is to say, this intractable disease can be cured. We have had a lot of such cases. Let's see this case. A historical picture shows chronic atrophic gastritis 8 months ago. After 8 months, the picture showed the normal state of the stomach. Intestinal tissues disappeared, which means no intestinal epithelialization occurred. Chronic atrophic gastritis is cured. Today, in this meeting, there are many experts of the digestive system. Results indicate that you can treat digestive diseases with a very good method. Other intractable diseases, such as liver cirrhosis, resulting from fibrosis, and hepatitis of various kinds, can be regeneratively restored. Now we will talk about the regenerative restoration of the liver. We spent 3 years achieving the regenerative restoration of a liver with cirrhosis. Let's see this case. The patient suffered from liver fibrosis for 30 years and splenox 7.3 centimeters under rib. Now the spleen has become a normal size, and the biochemical functions indexes of livers have been completely regeneratively recovered. This is not the only case where the patient has achieved regenerative restoration. In our experiment consisting of 208 subjects, many of them achieved the regenerative restoration of the liver, and even other organs were restored after the treatment. Next, besides the intractable diseases, we can also treat cancers. Cancer tissues can be regeneratively restored, and cancer cells can also be replaced by regenerative cells. As shown in this picture, this is a cancer tissue, more specifically a skin cancer diagnosed by pathologic examinations. After regenerative treatments, cancer cells were replaced by regenerative cells. 22 days after beginning the treatment, cancer tissue recovered back to normal tissues. The cancer tissue disappeared, and then skin organs regenerated. Let's take a look at another case. This cancer was cured after 20 days, so treating cancers is as simple as treating general wounds. Now, we also use bone marrow regeneration to counter cancers, especially cancers with respect to blood cells, which originate from marrow. Our treatment is not to kill cancerous cells like chemotherapy does. What we do is regenerate new normal cells from bone marrow, which is the origin of blood cells, to replace the cancerous cells. On January 2008, we announced that we wanted to help the terminal cancer patients pass their last days since they have given up medical treatment. As for the result of this project, we will release them in detail later. Here, the certificate issued by the hospital and granted to those who have given up on their treatment when they were discharged is shown. After joining our project, we performed a diagnosis, assessment, and result analysis for these patients. This picture is examination report before bone marrow regeneration. We spent 3 months regenerating the bone marrow of the dying cancer patients. This picture is the examination report before bone marrow regeneration. This picture is the examination report after the bone marrow regeneration. Of course, once bone marrow recovers to a normal state, leukemia can be controlled. This is a simple truth. Minister Shao was diagnosed with CLL. CLL developed even more slowly. But we believe that we will be able to replace the cancerous cells with the new regenerative cells through our regenerative restoration science and technology. More and more regenerated normal cells indicate the gradual recovery of normal marrow. The marrow are completely regeneratively restored when all cancer cells are replaced by normal cells, which is the fundamental principle to treat cancers. By now, I believe you have a clear idea about human body regenerative restoration science.